Hi there, this is Eric Ridley, Senior Editor of AntMedia.com, reporting from SIIM 2019 in Denver this week. Today I'm joined by Dr. Howard Chen from the Cleveland Clinic. Thanks for joining us today.
Happy to be here.
Great, thanks. So you co-chaired a very interesting session this morning on the 2018 Key Advances in Imaging Informatics. And I wonder if you could, for our viewers who couldn't attend, could you kind of recap and give us a summary of what you felt were the most important developments this year?
Of course. For machine learning and AI in 2018, some of the biggest advances have been the continual development of supervised learning, the ones that require annotation, but really the ones that have become much more exciting in 2018 and into 2019 is the development of what's so-called unsupervised machine learning algorithms. They're the ones that don't require human annotation, and what that means is that data sets can be much bigger because somebody doesn't have to be sitting there and identifying all these findings. So unsupervised learning techniques have become more sophisticated and being utilized in machine learning research this year. So that's something that we went over. Something else that we went over includes it's called reinforcement learning. So the idea is that kind of like a self-driving car where the car learns to correct its own course over time. We're seeing research that work around the sort of the radiology workflow and tries to figure out use case scenarios where the tool is actually auto-correcting its own errors as the user is learning it. So that's kind of the research improvement we're seeing over time in AI. For pixel data, meaning that these are the ones that are processing image information. Right. But something else that we're seeing as well is in natural language processing in so-called non-image data. So the non-image data, some of the best improvements you're seeing in quality improvement, you're seeing in business analytics. So in NLPs, one of the papers that we talked about are ways to use just processing the report. You can predict whether a patient is going to require further imaging down the road. So just by seeing surveillance CT reports, we can predict whether this patient is going to be a consumer of imaging resources down the line. And so these are kind of things that we have really sort of talked about in this session. By the end of the session, we focus a little bit more on the FDA regulatory proposal framework. So the FDA is, some of the developments in 2018, not just in scientific advancements, but also in regulatory advancements. Finally, our government is really paying a lot of attention on these high-power machine learning algorithms that have the capability of learning very quickly. Now, as medical devices, some of the problems that you see is that the medical devices, the hardware, development is a little bit slower, so every time a new version comes out, you want to be able to vet it, and the FDA needs to look at it before they approve it. Sure. But for software algorithms that are self-learning and are updated much more rigorously, the FDA doesn't have the bandwidth to just say that every day they're vetting the same algorithm over and over again. So they're creating framework that say, well, let's back off a little bit. What if we vet the institution and the vendor on their ability to produce quality algorithms, and we ask them to define exactly how these modifications will occur. As long as they stay within those frameworks and we know that they're doing the job right, we don't need to see this every single time. So that's the proposal. The details are still in the works, and so one thing that we told our audience at the end of the talk is that, hey, they're looking for comments and they're looking for recommendations. So take a look at that FDA regulatory proposal, and if you feel like there's something that needs to be addressed more a little bit better, then send a message to the FDA, and that's something that they can incorporate in their sort of final proposal.
And do you have any opinions on what could be changed in the proposal?
Well, so one thing that hasn't really been outlined in that particular document is what are these scopes of practice, so-called SPS and ACPs. Those are sort of, what can you change and how will you change it? Well, some of those can be outlined a little bit better. I feel like we haven't really dug into, what constitutes a sound protocol for algorithm modification. So that's something that, we have people all the way from clinical research down to basic science research that would benefit from just putting their voices in. So that's something I feel has a lot of room to grow from that document.
Okay. Looking ahead now to this year, and as you prepare for next year's session, and this is a tradition for you now to be involved with the key advances. Do you have any thoughts or predictions about what could transpire this year that you'd be highlighting next year?
Yeah, this is kind of interesting. I love to see what comes out of some of this research. So some of the what we see year to year is that every year things that thought to be it's research. We're not going to see that in clinical practice. Every year we're surprised. More and more of it move on, becoming FDA approved, FDA cleared, and we see in clinical practice. So what I expect to see coming in into the 2020 is to see some of what's so-called research, sort of unsupervised algorithms and sort of reinforcement algorithms or generative adversarial networks to actually make their way into the FDA clearance, FDA approval process, and start getting that attention in the clinical world. That you're starting to see some vendor products with it, or some quality improvement projects that are assessing and validating the work using clinical data.
Right, and that's the crucial next step, right, to get these algorithms into clinical practice.
Absolutely.
Great. Well, thanks very much, Howard. I appreciate your time today.
Well, happy to be here.
Great, thanks. This is Eric Ridley signing off for AntMini.com.